Hey YouTube, welcome back for part 2 of my video. In this video, I'll be sharing my experience with you guys. I had surgery on May 2nd, 2014 with Dr. Yily Santos. I ended up booking Upscale Recovery House for 7 days. Initially, I was going to stay for 14 days, but I decided to cut it short and just stay the 7 days. I changed my flights and they ended up charging me a $200 rebooking fee. So I wasn't too happy about that, and that's why I ended up staying 7 days to save a little bit of money. Um, I had got to Santo Domingo on May 1st. Angel, the driver from the recovery house at Upscale, he came to pick me and my surgery buddies up. I had 3 surgery buddies. Two had flew in the same day as I did. The other one had missed her flight and she ended up flying in the second day. Um, Angel, he drove us to Cipla, the clinic where Dr. Yily operates, and we got our testing done. We sat upstairs, waited around for a while. We ended up getting our EKG testing done. They hooked up a few monitors to my chest area, my foot, my finger, and I'm not sure exactly what they were measuring, but I guess I passed. Then we went downstairs, and this was not in Dr. Yili's office. This was the clinic, Cipla. We got blood work done. The lady, she drew blood. It was this archaic, this ancient looking needle. Um, Normally, when I go get blood work done, they take a needle, they stick it in my arm, then they switch the tube out for however much blood they need. This lady, she just took this old looking needle. It was clean, but it was old, and just distributed it into each tube that she needed. Then we got x-rays taken. It was a guy that did this, and I believe I got undressed from the waist up, and I felt a little uncomfortable. The guy didn't speak any English. He just, told me to take my clothes off. I'm like, what? Take my clothes off? Um, I stood in front of this machine and, I got the x-rays done of my chest area, I guess, and stomach area. Then Dr. Yili, she said she had 2 openings, or 1 to 2 openings that day. So my 2 surgery buddies had stayed behind, and they ended up getting surgery on me first. I wasn't prepared. My mind wasn't right to get surgery on the first. So I was like, let me go back to the recovery house and wait until tomorrow. They told me I was supposed to be the first patient of the day, and I was okay with that. So Angel, he drove me back to Upscale Recovery House. When I first walked in, they were kind of rude. They didn't really greet me. They just looked at me funny, and I was like, what the heck? Then Angel asked me if I wanted something to eat. The cook, she came, made me a plate. I sat at the table, and it was like a shepherd's pie or something like that. It was like potatoes with ground beef or something. It was decent. It wasn't what I was used to eating, but I mean, it was edible, so I'm not gonna complain. And they gave me some juice. It was really, really good. I really enjoyed the juice. It was like fresh juice. Um, I went and got the girls' bags packed, and Angel took them to Cipla since they were getting surgery on May 1st. And I got my bags ready for the next day and counted my money out and everything. Angel told me he was going to come back at 5:30 the next morning and take me to Cipla. So when I woke up, Angel didn't get there until about 6 o'clock. Um, I was supposed to be at the clinic at 6 o'clock, and we didn't get to Cipla until 6:30. The recovery house says it's a 10-minute drive, but after all the traffic, it's more like a 30-minute drive. So you might want to just keep that in mind. Um, I got the Cipla. I went upstairs to the fifth floor, which was where Dr. Yily's office was, and her office was closed. They said that they lost the key or they forgot the key or whatever happened with the key, and we had to sit in the lobby of the fifth floor with a bunch of other girls. And I wasn't sure exactly who was getting surgery that day. It was just like a bunch of girls in there. So when they finally opened the door, there was probably like five girls in there that were getting checkups done. They already had surgery. And then there was me and one other girl who um, was getting surgery that day. So total, it was five of us that were scheduled for that day that I know of. Four of them, well, four of them with myself included, is what I knew of beforehand, and then I met the other girl when I was there. So me and the other girl, we talked to Yili one by one, of course. She marked me up. I told her I didn't want a big butt. I just wanted um, like a little bit of roundness to my butt. And she said she understood me. I told her to make my stomach flat. I had a big, stomach, and I was like, whatever you do, make the stomach flat. Even if you don't touch my butt, make sure my stomach is flat. And I told her to like from the middle. She said okay. Um, Yira was translating for her because she couldn't understand English and I don't understand Spanish. So I ended up going downstairs after I got marked up, and I sat in the clinic at SIPLA. There was a bunch of other girls in there. It was a bunch of employees. I was just confused as to what was going on. They had like small little chairs, like so close together. So if you're a bigger girl like me, you're sitting on somebody's lap. So I wasn't too happy about that. I met some girls down there that were scheduled with Cabral and a couple of other girls that were scheduled with other doctors. And then they had this area where it had like a curtain that went around it, and there were like staff just standing around laughing, and they were drawing blood. I guess it was like a blood drive. I don't know what was going on that day, but they were so unprofessional. It was just like, what in the world? So finally, after waiting for so long, a lady called me back to the desk and she weighed me, gave me my results from the previous day, my x-rays and blood work and stuff. My hemo was a 13.6. The other girl that was sitting with me that was scheduled for that day, she um, she got weighed also, and her BMI was 35. Mine was 33 when I was there. I'm 195 too, and my BMI was 33 there. So I guess their BMI chart is like a little bit different than the US chart. The other girl, her BMI was 35. I'm not sure what her weight was, but they had to reweigh her because she was like barely making it. So after all that got done, we signed our paperwork and all that stuff, went upstairs in the room. This was supposed to be the room that we were staying in for the night. And one side had a one side had the door on it and the other side had the bathroom. And I believe both sides had the TV. I'll post a video later of this my side of the SIPLA room. The side with the bathroom had like an armoire in there. Um, and the bathroom was filthy when I first went in. They ended up coming to clean it while I was in surgery or something. Um, the room was okay. It wasn't like horribly dirty like some people might have experienced, but it wasn't like up to US standards. Um, there was another girl on the other side of the room, so they put me and the girl getting surgery done with me in one side, and then another girl was on the other side. And I'm like, what's going on? Why is there two beds in here and three people? And I had to argue with them about that. They told me that The other girl was supposed to be discharged at 10 o'clock, 10 a.m., and she wasn't supposed to be there. She was throwing a fit and all this other stuff. And once they get her out of the room, then we'll have two beds. I'm like, but still, why would you sit me in the room with her? You need to give me a free room. That's not fair. I paid for this room. Nobody else is supposed to be in here. What is going on? So, she eventually left, her and her sister, and the other girl, they came in, gave her her robe and her blue pill, and then I'm like, hold on, I was supposed to be the first surgery of the day. What is going on? I'm like, do you have our charts mixed up? I think they had my chart and gave her the pill or something. So I had to argue with them about that. Um, then they rolled her off. So I'm like, mad. Like, I'm supposed to be the first surgery of the day. I wasn't expecting to be sitting here, so nervous. My anxiety was kicking in. And they finally came, gave me my blue pill and my robe. I put that on. I didn't take the blue pill. They said that it was supposed to knock you out, and I didn't want to be knocked out and then wake up during surgery. Yura, she came in the room and she took my money and she asked me why I didn't take my blue pill. She said it's not supposed to knock you out like everybody else says. It's just supposed to relax you. And then I went ahead and took the pill and it put me to sleep. Yura, she took my money and she also held my phone and my excess money. Um, they finally came and put me on the stretcher. Um, they wheeled me to the room and sat me outside. So I was, I guess, sitting outside while they prepped the room. Dr. Yily, she came over, gave me a kiss on my forehead, and spoke to me. And then she disappeared. I don't know where she went. Because, like I said, I was laying there and I couldn't see anything. And when I got in the room, it didn't look dirty from what I could see. But then again, like I said, I was on the stretcher. Um, so the guy, he comes, he puts the IV in my left hand, and that was supposed to be my anesthesia. He puts a blanket over my face. Yes, I said he put a blanket over my face. So now I'm like panicking. I have like claustrophobic. I'm like, oh my goodness, get me out of this thing. I can't breathe. I can't breathe. I'm over here just dying. And then next thing I know, I'm out. I guess they started surgery on me. Like I said, I was out, and I woke up um, twice during surgery. Um, the first time while they were on my stomach, and the second time, I don't know what they were doing to my stomach when I woke up. I woke up like just briefly. I didn't feel any pain. And then the second time I woke up, I was laying on my stomach, and they were liposuctioning my back. And I'm flipping out like, oh my goodness, they're gonna damage a nerve in my back. Oh my goodness, they're, liposuction in my back. And the next thing I know, I was out. So, like I said, I didn't feel any pain, but it was kind of like a C-section where you feel the pressure, but you don't feel any pain. So, when I finally woke back up again, they were stitching me up. It wasn't Dr. Yili, it was some guy. And he said, almost done, we're stitching you up. So then they wheeled me to back to my room, and I tried to like turn over. I was in so much pain. I felt like nauseous, and I'm trying to lean over and grab the rail, and the guy's like, "No, don't do that. Don't do that. You're gonna bust your stitches." I'm like, "But I'm feeling so sick. Oh my goodness!" And I'm trying to get in a comfortable position. So he's like, "No, no, no, no. You're gonna bust your stitches. Don't do that." So I tried to lay still. They wheeled me into the room, and the other girl who got surgery the same day as me, she wasn't in the room. They said they ended up giving her a different room, and I don't know what happened, but I didn't see her again. Um, she had stayed at a different recovery house than the rest of us. So I'm in the room, and Mildred, the nurse from Upscale Recovery House, she's there, and she feeds me my soup and, massaged me and tried to help as much as possible. But, there wasn't really much for her to do. Um, I would recommend getting a nurse or something like that, or like somebody to stay with you, because um, if I didn't have her, I don't know what I would do. I was kind of freaking out. She kind of calmed me down, and like I said, she massaged me. For some reason, like my butt was hurting, and I couldn't feel my legs. It was just like, what the heck is going on? So she handed me my bobby pillow, and I sat on the bobby pillow. And although everybody else recommends to bring the bobby pillow, so you don't lose your fat, I recommend bringing the bobby pillow just so you can sleep comfortably. If it wasn't for the bobby pillow, I wouldn't have been able to sleep comfortably. Um, and most of the surgery, well, the recovery process, I was sleeping. Like the first week, I was asleep most of the day. So, anyway, like I said, she helped me out a lot. There was a TV in the room, but I don't remember watching it. I was in so much pain. The nurses from SIPLA, the clinic, they came in about every 6 hours to give me my pain medication. And the pain medication wore off probably every 3 hours or so. So about 3 hours, I was, sitting in pain. Um, Once Mildred left, the nurse from the recovery house, um, there like there was nobody in my room. I was just by myself. I had to go to the bathroom, and nobody was there to help me. And I was, calling for someone. Nobody came. And oh, I forgot to mention the nurse from the recovery house. She didn't speak English. She only spoke Spanish. So there was a barrier when I tried to ask her stuff. She didn't understand me. I had to use my translator on my phone, which was a hassle. And even then, she couldn't understand me. So yeah, so the next morning, like I said, I woke up. She had left. There was no nurses around. I had to go to the bathroom. I ended up getting up by myself. Um, oh, I forgot to mention that she came and switched my IV from my hand to my foot. She stuck me so many times with a needle that night. She couldn't, I guess, find the vein, and she ended up sticking me in my foot, so I couldn't move the whole entire night because I was scared that my pain medication would come out. Um, but anyway, I got up to go to the bathroom, and I used the pole that the IV was on, and like I said, I was in so much pain. I went to the bathroom by myself, and um, it was just crazy. Anyway, Angel ended up coming in my room to get me, and I was sitting on the toilet, so that was pretty embarrassing. And then they came in my room and put my faja on. When I got up to put the faja on, I almost fainted. I don't know what happened, but I was sweating. I was so hot. I was dizzy and lightheaded, and I was about to tip over. So they got me some tea, and after I drank the tea, I felt a little better. And then they put the faja on. They didn't button it up. They said for tummy tuck patients, you don't button the faja until like the fourth day, the third or fourth day. So anyway, um, I had to buy a respirator or something. It was maybe I could find it and show it to you guys in another video. But it's a thing where you inhale and try to inhale and move the ball up to the top and hold it for 10 seconds or something. Um, I believe that was $15, and I bought that before I left the clinic. Um, I paid the nurse from the recovery house $50. I don't know if I mentioned that before. And we drove back to the recovery house. I ended up getting sick on my way over there, and when I got out the car, I almost fainted again. I was feeling lightheaded, shaky, same thing as before. And the nurses all ran out, came to get me, and took me back into my room.